agenda. This event will be recorded, and that's always a nice reminder that we have on our first slide. And go ahead, Kayla, with showing the agenda. So what are we going to talk about today? Of course, welcome and a little introduction for those of you who are not familiar with the team, why we do this, some updates, and then Justin is our report specialist, and he's going to talk about anomaly reports a little bit. Kayla is going to be talking about the administrative pause. The MOTS monthly client report is Justin again. Roads Go Live, the new system that we are working on so hard and been testing very diligently lately, is Jody, and also the provider update webinar coming up. Also, Jody, a little intro to MOTS monthly meeting that we have. Mary will be talking a little bit about that, and then the usual spiels if you're switching from EDI to a different EDI or from CE to EDI with Jody. And then we still have some room for Q&A, and we always show our contact information. Again, welcome. This is recorded. For those of you who have any questions or issues, just put them in the chat, and we have several people monitoring it who are not presenting at that time. So hopefully we can kind of either bring them in the meeting or save them for later and get back to you, and hopefully we can talk about that. So, okay, go ahead. Okay, let's show the team. Pretty sure everybody's pretty familiar with Kayla Kameli, or just Kameli, as she's been yelled at the soccer pitch. Our MOD system administrator and Rhodes product owner. Blah. Cecilia, she's not here. She's manning the phones because somebody has to man the phones while we're here chatting away. Myself, senior systems analyst. Mary, of course, always around and very helpful because of her many, many years of experience. Jody, EDI technical expert, and also Rhodes product owner. Rhodes will be a big thing. So we have two product owners, and Jody focuses a little more on EDI, and Caleb might have more to say and to do about the CE, but they both know very, very much about all the new things coming. So it's pretty exciting. Justin is our MOTS report specialist and the research analyst. He is moving that task over to Anna, who is becoming more and more the MOTS report specialist and also our data analyst. And once we get in the transition of moving from MOTS to Rhodes, that MOTS will be replaced to the Rhodes name. So, okay, that's a quick overview of the team. Go ahead, next. And okay, why do we do this? Well, of course, we want to give information on changes and enhancements. As you all are very aware, MOTS will not change anymore and will not get any enhancements. I'm pretty sure, because the road system is coming up, so that would be silly to do that. But we keep getting these webinars because maybe there's the other day we had fentanyl that was added to a drug that would be a problem for individuals. So there might be changes, or we can discuss data issues. If we see some trend and people are missing out because they think we're moving to the next best thing and they don't have to worry about it, we'd like to introduce it and make sure that you are aware of what's happening. Get your feedback. Maybe we are slacking because we are too focused on the new system and there's still things that need to be taken care of, or you have questions and ideas for the future, and we'd like to hear that too. And one of those things will be maybe a topic for the next webinar that might be coming up. So hopefully we can answer all your questions that you might have today, and if not, then we'll have emails, addresses at the end where you can send them to, and either we can answer them or find somebody within our organization to answer that question for us. Thank you, Kayla. The next, one more. News update. Resilience Outcomes Analysis and Data Submission System, the ROAD system. I like that name, Resilience Outcomes Analysis and Data Submission. We are currently in cycle number 3, and we've been very busy in user acceptance testing. Everybody is doing bits and pieces, and we have it nicely divvied up to make sure that all the screens and all the fields and everything is tested for the new web version of the ROAD system. And we found some little bugs, but the developer, the contractor is Ernest and Young, EY as what we call them, and they've been very busy fixing plenty of them. So it's coming along pretty good. It's still a little new and uh, takes a little time to figure everything out. But there's great communication, and I'm beginning to like Teams more and more. When it first started, I was not too thrilled about it, but I think everybody is getting more familiar with it. There's a lot of communication going on, and the testing seems to be going pretty well. So uh, cycle number 4 is coming up, and it will start next week because that's how we do these things. We're working with agile system development, which means we create a piece, we test it, they fix all the breaks, and then they add the next piece, and so on and so forth. Um, Go live has been postponed, but you will have another slide about that with a little more details. The same goes for the reporting administrative pause that ended this weekend. So, but we also have a slide with the details. And as I said, the MOTS support and road support, we have email addresses. They're not new anymore, but those are the ones that we have for a couple of months now, and it's mod support at Oregon dhsoha.oregon.gov and the roads OHA at Oregon.gov. Okay, that was my short news update, and more details are coming up next. The following person is Justin. He's going to talk about anomaly reports. Go ahead, Justin.
Thanks, Pete. Yep, it's me again about this stuff. So there's a lot of text on the screen. I'll summarize it, especially for those of you who may be doing more listening than watching of the webinar. This information also should have appeared in a recent MOTS Messenger newsletter, at least I think it did. But as many of you know, every month we send out a series of anomaly reports. In fact, October's reports will be going out tomorrow. There's about 600 to 700 of them in total. That's statewide. You can blame me for that if you want. I built them. But these are lists of situations in MOTS where the data looks like it might be wrong, but we can't tell for sure. There's some easy examples there on the screen. Maybe we've got an 8-year-old client with a marital status of divorced. That's unlikely in the real world. But is the marital status wrong, or did someone enter the wrong year in the date of birth or the admission date, which could make the age wrong? We're not sure. Or maybe we've got a client with test in one of the name fields, which can happen. But is that actually their name, or was a testing client accidentally entered as a real one? Stuff like that. We're bringing up the subject again partly because as I was reviewing these reports recently, I noticed a client with a last name at birth that was something like refused to answer or refused to provide. And that client has been showing up in these reports since they were initially developed years ago, and we'd really like to get this stuff resolved. Because you're probably tired of seeing these reports, and we are too. You can make your facility's anomaly reports smaller. You may even be able to make them to stop. So if you look at the list that we send out and you find an inaccurate record, please log into MOTS client entry, fix it, and submit the changes. The MOTS database will pick up the change and the client will disappear from future anomaly reports. If it's something you can't change, such as the last name at birth or the date of birth, send us a correction request so we can edit it for you. And you can do that with our official change request form, which is on our website, or you can just return the anomaly lists with notes about what should be changed. And if the data really was entered correctly, even though it looks weird, let us know. We can hide the false positives from future anomaly reports. And with all of that, if enough of the anomalies are resolved and if enough of the false positives are hidden, then those anomaly reports will not be generated for your facility because MOTS will not detect any odd-looking data unless something new shows up. And just to finish up here, I also want to mention that there are some facility staff members out there who respond to the anomaly reports every month, effectively keeping their lists to a minimum. Some of you even respond within a matter of minutes, which is much faster than we expect. But for all of you who do respond, thank you for your efforts.
Thank you, Justin. Yes, and it's very important to take a good look at these reports because given the fact that we are moving to a different system, we're bringing the MOTS data into the new system. So we want it to be as clean and neat as possible, because otherwise we might be stumped for importing it into the new system that might be a little different. So the cleaner, the better. So thank you, Justin. Okay, the administrative pause. Kayla, that's you.
That is me, but I just looked in the chat. It looks like Nicole had a question about receiving emails for webinars. Nicole said that I used to get emails announcing these webinars, but I no longer do. But you set a reminder in Outlook, which is great, a great coping skill for not getting those emails anymore. We switched platforms for the webinars probably the beginning of this year. Has it really been that long?
Yeah.
So it might be that change, but I can look into the settings in Teams to see if we can get a reminder email sent, if that would be helpful. I'm guessing there would be a setting for that we can change. So I'll look into that, Nicole. All right, I'm going to move on. This is Kayla Camelli talking. Also, if my bubble's not lighting up, and I'm going to talk about the administrative pause that ended the beginning of October, which was a couple days ago on Sunday. During COVID, the state was trying to scale back reporting to ease burden on providers. Now that the official public health emergency has ended, the state and all the people in charge decided that we should go back to our regular reporting schedule. So I wanted to throw this in the webinar today to just give a reminder of the types of information that folks are submitting and what the timeline is for those submissions. So a new client in a new episode of care, that information should be reported within 7 days of admission. For a crisis event, also within 7 days, along with an involuntary service event within 7 days. A non-Medicaid service, we would like to see within 30 days after the month the service was rendered. For a status update, which is a little bit different type of data submission, right? Because this is the data you've already submitted and you're just updating the fields that have changed. So that is what we expect every 90 days. And then once an episode of care or a treatment episode is completed, we expect to be notified of that end within 30 days. And I will also be sending this out in the next month's MOTS messenger. So it'll be in the newsletter if folks would like to keep it handy. It'll also be posted on our website in the MOTS messenger section so that you can refer to it if you need it. And I'm going to pass the microphone back to Justin.
I just have one comment that for the CE clients, the CE providers, the 90-day update is also even if there is no change, because that happens. We would still like you to go in and make sure there is nothing different, because some change might have come into your paperwork and you forgot about it almost because it came pretty quickly after you entered the first one. We'd like you to check it, go in, make sure everything is still correct and make the updates. But even if there are no updates, if you submit it, then we know that you guys are on it and you're checking and making sure everything is correct in there, because we have other reports that kind of check if records are updated or not. So, and then we can see, even if there are no changes, if you submit, we'll still have a check in the database saying, oh yeah, they checked it, so that's good. There is no changes, but it's still corrected, and they're looking at it and they're making sure they're submitting, at least checking it at least once every 3 months.
That's right. That's a great distinction, Pete. Thanks. And folks would just do that even if there's no changes, just by clicking the submit button. Yep. Right? Yeah.
All right, back to me again. This one we're bringing up because we've had a few questions about what reports go out regularly and who is supposed to receive them. So here's a list of the standard reports. The active client monitoring report is just a list of all the clients that MOTS shows as active and then a number of days since the last time they received an update. That goes out on the 1st of every month to the facility primary contact. And then the anomaly reports, which we've mentioned, will go out on the 5th of each month also to the facility primary contact. The rest go to the agency primary contact. There's a summary of all the non-Medicaid services that have been submitted within the past few years that goes on the 15th, as well as the performance report. That's the pie chart that shows a count of clients who have been updated within the last 90 days or the last 90 to 180 days and so on. And on the 2nd of the month, there's also a summary of crisis submissions and involuntary service submissions, which doesn't apply to everybody, but if you do submit that data, you'll get a summary of it. And just a couple of extra notes on this one. We're limited by some factors in the system so that the reports can only go to an individual. So the active client monitoring report, for example, you may want that to go to a whole team of staff at your organization, but unfortunately we can't do that. It can only go to the facility primary contact. If you're not receiving these reports and you think you should, please let us know. We can make some changes so that you do receive them.
Excellent. Thank you, Justin. Next one is Jody.
All right. Thanks, Pete. So, yeah, we wanted to take a few minutes here to kind of get you up to speed on where we are with the roads project. As we've mentioned, the modernization and enhancements to the MOTS system. So, our go live date, we kind of looked at a lot of factors and we made the decision to move it from December 2023 to April of 2024. So, a lot of things went into that, as I mentioned. Obviously, we want to try and reduce administrative burden. We want to have a smooth transition. We also really wanted to include some of these other data collection that's happening, such as 988 stabilization services and Measure 110, um, into the system and as well into the documentation and specifications for the EHRs, the electronic health records companies that work with some of the EDI providers. We wanted to be able to give an exhaustive list of all the things so they could have a singular build, hopefully, for the things they'd be bringing in. So by moving the date out a tiny bit, getting us into spring, so we'll get through winter and be launching this thing in spring, we found that we would be able to get more inclusiveness, which should help with cost and different things as well for development on the EHR sides, but also for the client entry side, we're going to be able to have these things available for you to put your data into upon go live is the goal. So a lot of things went into that. We understand that people are kind of anxious. We want to make sure we prepare for this transition. And we kind of felt like, also we could, get through the holidays, get past the first of the year, and get us into, that quarter of the calendar year that kind of aligned better with a lot of things. So definitely specific dates are going to go out for the EDI documentation for any of you on here who might be submitting your data through the electronic data submission method. Those documents, we're going to be getting dates here closer to distribution to you all. We are going to be having some provider engagement sessions, and then training will be announced over the next few weeks. And training will be for the system, and it would be dates out into next year. But we want to make sure that folks can get those on their calendar and have the right people and resources available for us. So I know hopefully that gives a little bit of reassurance on why we moved the date and that we really wanted to get a full inclusive um, data collection effort. to keep, to reduce those administrative burdens with you having to report to many different locations. So I think that is kind of wraps where we are with the rescheduled date. Any questions in the chat by chance?
Not
I don't
seeing
see any.
anything. Nope.
Okay, excellent. Well, if that's the case, we can move to, I think, the next one. So, as we mentioned, we are going to be having the what we call provider engagement or provider update webinars. And we were able to secure 4 dates. And I believe Kayla is going to be actually putting the links in the chat for the thing that says register here. But we have two aligned for EDI, as you can see the 2 dates there on Monday and Thursday of the week of the 6th of November. And then we also have client entry the following week, which will be on Monday and Tuesday. So we tried to do a morning and an afternoon time slot. So hopefully everybody can make it. There, we should have plenty of room and bandwidth for multiple people to attend these. I would encourage you to register early if possible, in case we do need to logistically put some more sessions out there. That'll help us to kind of know that early. If for some reason your CE and the CE ones don't work for you, or your EDI and they don't work for you, join one of the other ones, because you're going to get at least a good broad amount of information, even if you have to join one of the other ones that you aren't technically submitting data that way. We'd rather have you there and get what you can. I think that some of these are going to be recorded. Is that correct, Kayla?
Yep, we'll record them and then I'll have them posted to our YouTube channel and I'll link them in on the website and also in the next MOTS messenger that goes out.
And I believe that there'll be some Q&A and, where you can unmute yourselves or whatnot and actually ask some questions. So it'll be a great opportunity to, if you've got folks at your organization that are kind of wanting to know what's going on, or maybe some of your leadership or whatnot, feel free when you get this information to pass it along to those. So yeah, we will be putting these out, and then after that after these are completed, then we will be looking for additional dates in the future, to kind of get a cadence. So okay, anything else you'd like me to cover there, Kayla, or did I get it?
No, I think you got it. I put
right.
the table that was on the screen in the chat, so the links are there for folks to register. And if you're not sure now but would like to wait, this will also be in the next MOTS messenger. But that'll be in a couple weeks. So if your calendar fills up quickly, I'd do it. I'd follow Jody's lead and pick one now so it doesn't get lost in the shuffle later.
Excellent, Kayla. Thank you. Mary, you're up next.
Hey. So thanks, everybody. We just wanted to let you know that if you're new to MOTS or you need a refresher, that we offer a welcome to MOTS every second Wednesday of the month. So the next one will be next week on the 11th. And it's a chance for you to review what the MOTS client entry portal looks like, the pages and everything. We'll be going over how to look for a client, how to enter a client, how to update them. If you do crisis, how to enter the crisis or a non-Medicaid service. We might even show you, if you're an administrator, what the agency profile pages look like and how you can update your information. So it's just a chance for you to come with maybe questions that you have, or just to get a broad overview of what the client entry looks like. Um,
Thanks,
and
Mary.
all right.
And I also just put that link in the chat as well. So if you would like to attend our intro to MOTS, or if you have someone on your team that's new that might need to know what MOTS is and why we exist, feel free to send them that link and they can sign up for our webinar next week.
Thanks, Kayla. Yes, and it is very important, and I think it's very helpful if you take a good look at the MOT system, because one of the reasons we are gathering all the information is, of course, that we have to report to the federal government. And a lot of that information that's currently in MOTS, a lot of the data, a lot of the similar fields will be showing up in roads. And I'm pretty sure that part of the training will be referencing to how we used to do it in MOTS and what we did and didn't do and what we added and changed and stuff like that. So I think it would be very helpful to have a good idea of how MOTS works and what the data fields are, because you might be uh, want to know a little more about all that stuff. So then you're, I think, better prepared for the next step. Thank you. And then we go back to Jody, switching from CE to EDI or EDI to EDI. Go ahead, Jody.
All right. Thanks, Pete. So yeah, this is kind of a pretty much a staple for every webinar. One thing I will say that
You should record it one day, Jody, and then just play it.
I know, and just hit the button. What I what I will say is what Pete mentioned is that as we go even from MOTS to roads, the understanding MOTS and understanding what it's doing in any of those webinars you can attend, or things, it's really going to help you, because it's just going to be an evolvement and kind of adding on to what you've already learned with MOTS, and that is going to be a body of knowledge that is still applicable and usable as we go into the road system. So you're don't feel like, oh, I need to wait till roads comes. It's like, no, kind of get your feet in there and start kind of figuring it out. If you got new people, it'll be super helpful for them. So this slide is switching from client entry to EDI. And one of the things that we kind of always want to remind folks, just a few steps and stuff that's important. Um, First of all, let us know if you're going to thinking of changing, or maybe you're not sure if you should, or maybe you even are EDI and you're considering a different system that doesn't necessarily have an integrated electronic thing. Just let us know and we can help you, give you some information, like if you need to see what CE looks like or vice versa. So let us know. We want to get you on our calendar and make sure that we have resources available to assist you. The second thing is that there are many different electronic health records systems that are sending data to MOTS electronically, and they all do. At the end of the day, they send the file, and it meets the MOTS requirements for the file. But each of them do things a little differently. So as you're looking around, or if you've already made a decision on one, just really kind of delve into like the MOTS functionality piece, like what's going to happen from for your business process, who's going to do which things, who's entering the data into your electronic health record system, because there will still be some staff time required. There'll be steps to do, and it's just going to be a different way of doing it, and it definitely will streamline things for you, putting them into your system and then getting them into ours with a file. um, just understand how that works, especially if you're looking around. There's no one way that's better than others, but we've found that sometimes certain ways align with an organization's needs better. So ask about that. Project timing, I kind of already mentioned. We do have a process for changing you from client entry to EDI. We've done it now for about 10 years. So we've got that nailed down and we'll go over it with you. If you are client entry going to EDI, you will have a process and some paperwork. We're going to set up a place on our server where your files are going to come to. And that's called a secure file transfer protocol setup. It's kind of like your mailbox here at the state for MOTS and roads to grab your data. Client ID considerations, we kind of want to talk about, like when you get a hold of us, that'll also help be one of the things, like, are they all going to need to change to what your new system is, and what resources do we need to have to assist with that? Um, defining business processes. It's just a recommendation internal to your team around the MOTS functionality of your new EHR. And the testing of the files, what that means is like you may go with, EHR ABC, right? And they already have 10 providers that send data to us. Well, the testing of the files will happen at your organizational level, even though they already have others sending data to us, because with all the customization and different things to fit everybody's workflows and forms and different flows, we want to make sure that all that mapping is correct. So we'll test your files, we'll go live, and we'll do some follow-up, and that follow-up can be as much or as little as needed. It's really there just to help you once you're submitting files and doing things. If you've got any questions, we can set up a reoccurring deal on the calendar and at different cadences or frequencies that work for your team and, of course, for our team as well. So it's really pretty smooth. It's some work, but we're all here to help you go from CE to EDI or vice versa. So yeah, I think that's it for my stuff.
Excellent. Thank you, Jody.
Yeah, you're welcome.
I'm looking at the chat and I did not see anything. So yeah, as I mentioned in the beginning, the recording will be posted for those of you who would like to share it with your coworkers or somebody else in the organization, or listen to it again to make sure that you got everything that we talked about. The MOTS website also has previous MOTS messengers and newsletters and the future webinar dates, so you can be fully informed about how things are going here within the campus unit. The next EDI focused webinar will be November 1st, and that is a Wednesday, yes. And the signups are available also on the website. And if there are no further questions, thank you for joining today. And then we have one more page with our contact information. As you can see, if you need to chat with anybody or want some more information, forgot something, or something comes up, or somebody within your organization has any questions, these are all the new emails with the at oha.oregon.gov. And I think there's still some .state.or.us out there, and it still gets here. So that's usually quite a while that they keep rerouting those automatically. But do check if you send email to us on a regular basis with some questions or something, that you have the update, because eventually it's going to time out. So we're all oha.oregon.gov. Did I miss anything? Anybody else has anything they would like to add, or think we're good? Well, short and sweet.
Yeah, I think we're good.
Excellent. Thanks, everyone. Have a wonderful rest of your day.
Thank you all. Bye.